We were confused about what treatment path that we could also try because we'd gotten two very different recommendations on what we should do with Patrick. And we came to CHOP looking for a third opinion. And I have to tell you, it was one of the best experiences we could have asked for because we sat down with Dr. Maris and he laid out everything that CHOP had to offer. And it gave us a renewed sense of hope, and that's exactly what you need in the relapse setting. So we kind of came to CHOP confused and needing hope, and that's exactly what we got was hope and a little bit of clarity. And to me, that's one of the most outstanding moments of this whole journey.
We're one of the busiest children's oncology group institutions in North America. We are very focused on offering specific therapies that are earlier in clinical development, brand new targeted therapies, brand new therapies that are just being developed for cancer patients and for pediatric cancer patients. So there is a wide variety of these earlier phase treatment options that are available to patients whose cancers have recurred.
When a patient comes here to be treated on a clinical trial, it makes all the difference in the world that the physician who developed that study is here, who understands the trial the best, who understands the treatments that are being administered and the potential complications and can explain those to the patients. Oftentimes, we are called from other institutions around the country regarding those clinical studies to provide answers to those questions for the patients that they care for.
Here at CHOP, we're one of the first places that a proton program was conceived and built with children in mind and built side by side with our oncology program there to support it, so that a child that comes here to get proton therapy has the advantage of the CHOP oncology program there to support the child in their chemotherapy and all of their other medical needs while they're getting their proton therapy.
Proton therapy, boiled down, is a different type of radiation therapy that has the very strong potential to provide curative radiation therapy in a much more precise manner. It was designed to be able to get the bad stuff and spare the surrounding tissue. We view it as a way to expand the reach of what radiation therapy can do by reducing both the short-term and long-term side effects of the treatment.
We have surgeons with tremendous depth, and they have experience with both the most common pediatric cancers and some of the more rare form of cancers.
I would say the best part of our experience here has been the quality of life that it's given Patrick. Because some of our other options when Patrick relapsed were to throw the most toxic, sickening chemotherapies at his body. But here we have new medicines he's never seen. We have medicines that are working, that don't make him sick. He's going to school, he feels great, he's sledding, he's playing with his sisters, he's having a great life. And you can't really ask for more than that.